Welcome. My name is Cindy Wright, and I'm a program manager at the Child Neurology Foundation. Today, we're talking about depression in our new normal with a focus on children and families with neurologic conditions. We hope today's conversation provides information on how to recognize some of the signs of depression and empowers you with actions you can take to help care for yourself and your family. I'm joined today by Catherine Ettman from Boston University School of Public Health. Welcome, Catherine, and thank you for joining us today. To start off, can you please tell us a bit about yourself?
Thank you for having me, Cindy. So my name is Catherine Ettman, and I serve as Director of Strategic Initiatives at the Boston University School of Public Health, and I'm also a doctoral student at Brown University School of Public Health.
Great. So there's been a lot of talk about the increase of depression due to COVID-19 pandemic, and especially for people who have additional stressors. And providing for a child with a neurologic condition can be stressful, and knowing that these children can be at greater risk for serious side effects of COVID is definitely creating additional stress for our community. So can you share with us just how significant depression is during this pandemic?
Sure. So our research team was interested in the same set of questions. So we wanted to know, how is COVID-19 affecting mental health of adults in the US? So we conducted a study in March and April of 2020 to understand the prevalence of depression across adults in the US during COVID-19. We asked a nationally representative group of adults questions about their mental health, asking them about a series of symptoms, their experiences with COVID-19 stressors, and demographic information. And we compared these findings to a nationally representative sample from before COVID-19 so that we could look at comparable samples of depression before COVID-19 and during COVID-19. And what we found was three main findings. So first, over 1/4 of Americans reported depression. So this is 27.8% of Americans. And this represented, number two, this represented a threefold increase over what it was before COVID-19. So we found that that the prevalence of depression was threefold higher. So it went from 8.5% to 28.7%. And we've seen increases in depression following other traumatic events, such as September 11th, Hurricane Katrina, and Hong Kong unrest, just as examples. But these rates were much higher than what we have seen in the general population after other events. And then third, we found that people with fewer resources were the ones who were more likely to report depression. So for example, people with lower income were almost 2.5 times as likely to report depression, and people with low family savings were 1.5 times as likely to report depression as people with more savings. So we found that indeed we are experiencing high prevalence of depression during COVID-19, and that this is much higher than what we've seen after other traumatic events.
And so this data was collected in April, and I think, the outcomes, I think, in March, April, there was some predictions that this could, hit 250,000. By the time this airs, we may have already hit 250,000 deaths. But do you think it's even worse now?
So it's hard to say. We think that what we were picking up in April was that this wasn't just COVID-19. So yes, this was COVID-19 and the fear and anxiety around catching COVID, but it was also the economic consequences that we were already starting to feel. And evidence for that comes in particular from the disproportionate burden of depression on people with fewer resources, so lower income, lower savings, and those people who are experiencing more stressors. Since then, one might say that we've experienced multiple traumas. So we have COVID-19, again, in fear and anxiety around catching it or spreading it. You have the economic consequences, so dealing with the unemployment rates that have been increasing or in some places stabilizing, but we've still had to deal with that fallout. And then since that time, we've also seen the social unrest that has emerged in these months. So it's hard to say how depression has changed over time, but if the stressors have continued, it has to do with the underlying stressors. If the underlying stressors have continued, then it might be possible that depression has stayed the same or gotten worse for people who've been affected. But then again, if those stressors have improved, then we're hopeful that maybe depression rates may improve in certain populations.
And so do you know why this pandemic, or do you have an opinion on why this pandemic has had such a huge increase? Like, is it, I'm assuming it's compounding factors.
I think so. I think it's the fact that we have these cumulative stressors all at once. So we're seeing job loss and difficulty paying rent, financial strain. In normal times, those stressors are associated with poor mental health. And now in COVID time, you have the additional stressor of changing your routine. So other research has shown that changing routines can also shift your mental health. So mental health is very sensitive to the context around us. So it's sensitive to social environments, to economic environments, to home environments. And other research has shown that changing simple routines, so changing your routine for going to and from work, or your sleeping habits or your eating habits, these are associated with shifts in mental health. So in part, I think that what we're seeing is that our contexts have been changed. And as a result, our mental health is responding to those shifts.
Right. And I know a lot of families in our community had help, whether it was family or professionals coming into their home. And so now they're having to do a lot of work and sometimes not able to get a break because there's no one else who can come in and help them. So, and
Absolutely.
what are some signs, like, so I learned the hard way with my son that anxiety doesn't present the stereotypical way that I thought it presented. It can present in other ways. But what are some signs that caregivers may notice either in themselves or in their child or family members around them that they might be getting depressed?
So first of all, I should note that I am not a clinician, so any formal diagnosis of depression would need to come from a medical professional. However, for our study, we use the Patient Health Questionnaire 9. So this is a screener, which is self-administered, and it's a series of 9 questions, which you can use to take to understand whether you have symptoms of depression. And this survey questionnaire has been validated, so it's very close to clinical diagnosis, but I should just note that a formal diagnosis would come from a medical professional. But the questions that we asked in our survey, this Patient Health Questionnaire 9 says, over the last 2 weeks, how often have you been bothered by any of the following problems? And you can say not at all, several days, more than half the days, or nearly every day. And then we list a series of examples. So for example, little interest or pleasure in doing things, feeling down, depressed, or hopeless, trouble falling asleep or staying asleep, or sleeping too much. We also include feeling tired, having little energy, having poor appetite, or on the converse, overeating, feeling bad about yourself, like you've let yourself down or you've let your family down, having trouble concentrating on things, things that you would normally do, trouble concentrating on reading or watching television, or moving or speaking very slowly so that people notice, or conversely, being very fidgety and being restless such that people around you notice that your behavior is different. So these are some of the symptoms that we might look for. And what we would want to be on the lookout for is you would want to have more of more than half of these signs more than half of the time over the last 2 weeks. So we create a symptom score where, depending on how you respond to these symptoms, if you're feeling some of these nearly every day or more than half the time, then that might be an indication of probable depression. And that's when screeners like this can help to identify when getting medical treatment or additional support can help.
Now, can families access a screener and screen themselves, or is it something their doctors would do?
So this screener is available online. I do recommend that people go to a clinician so that they are able to get that help and that support if they're starting to sense that some of these symptoms might resonate. I would err on the side of just talking to a provider who could really help give the care and support that could help.
Right. So if parents or children are noticing these signs of depression, what are things they can do now to help manage?
So I'm not a clinician, but things that have been shown to reduce depression include going outside, being in nature, getting exercise, and sticking to routines like regular sleeping schedule, regular eating schedule, and staying socially connected to people.
Great. Yeah, I know we've done a lot of content on helping with children manage behaviors, and it's always get that routine. It's a different routine, but get a new one. Consistency is reassuring, and I know it makes me feel safe when I know what to expect. So the other thing I've heard from parents is sort of this: if I can just get through the next few months, depression will go away, and there's nothing I can do now but wait. What are your thoughts on sort of that approach to managing depression?
It's hard to say. Every person is different, and it's hard to say what will happen in the future. And in part, people's ability to rebound depends on the underlying stressors. So if underlying stressors improve, then we would hope that mental health would improve as well. And if underlying stressors remain or get worse, it is possible that more people may experience poor health. And if people are feeling these symptoms for a significant amount of time, it can get worse. So if people are starting to notice some of these symptoms, we hope that you would recognize it, acknowledge it, and potentially seek treatment, because help can reduce the negative impact and it can ensure that it doesn't get worse over time.
Right. Yeah. I mean, I think about I personally am on antidepressants, and I think if I had a heart condition, I would have no shame with going to a doctor and saying my heart's not beating right and taking medication. So same thing, my brain's not running right. But I know a lot of people don't feel that way, and there is a stigma with getting medication, or even some people think seeing a psychiatrist or psychologist is somehow shameful. But
we're hoping that in part with this work, we can aim to reduce stigma around mental health and to raise awareness. So many people are going through this right now. So anybody who's feeling a little down during this moment, they should know you're not alone. And to your point, I do think we can think about mental health like physical health. So just like what you said, if you were riding your bike and you broke your arm, you would get a cast, and nobody would think twice about it. And in fact, people, if you didn't get a cast, they'd say you should probably get a cast to help you heal. And it's the same thing with mental health. So if people are feeling depressed or they're feeling down, medical care can help. It's that cast to help you recover, to get back on track. And our hope really is to raise awareness. And in part, we're really grateful to have conversations like this. And we're grateful to you and your colleagues for raising awareness for the importance of mental health.
Thank you. We're happy to do it. And so in your opinion, what are some of the sort of mental health consequences of COVID-19 and social distancing? I know one thing is, finding your family and your community can be uplifting. Now, not that easy in certain places. So what do you think is going to have as an impact sort of on our population at large? So with a public health perspective, what do you think might happen, and what is there anything that we can do as individuals to help?
So I think that this moment has taught us a lot. So to start, it's taught us that social and economic factors do shape our mental health. And mental health is critically important. And many people across the country may be feeling symptoms of depression or anxiety during this time. And I'm hopeful. I'm a hopeful person. I'm hopeful for what we can learn from this moment. So from our research, I hope that first we can raise awareness for the prevalence of depression and poor mental health during this time. Second, I hope that we can create opportunities for screening so that we can help identify people who would benefit from help. And third, that when we do have treatment, that we make sure that it's accessible to all people who need it, not just those with more resources. So one takeaway is that given that our research shows us that there's this disproportionate burden on people with fewer resources, my hope is that we can invest societal efforts to support people with fewer resources to help mitigate the mental health burden of this pandemic. And things that make a difference are the basics, like having secure housing, societal efforts to have good food to eat, having stable employment, livable wages, having healthcare that's not tied to employment. So it's possible that this moment can be a doubling down in our societal investment in each other and in supporting people through difficult times. And then last, I think one of the most important lessons I know I've learned from this time is that social support really helps. So we may be physically distant, but we do not have to be socially distant. And if we can stay connected to our friends, to our families, to our supports using technology to check in and support one another, then that can hopefully be a positive lesson that we learn from this moment and that we will take advantage of once this moment is beyond us.
Right. Yeah, it makes me think about someone offered advice, and I'm not even sure where it was or who it was, but it was basically that don't ask someone if they need help, give it, right? And so if you say to someone, how can I help you? That's almost a burden on them, or they may not feel comfortable. So the idea was, bring over a warm meal, or just say, hey, I'm gonna take your kid somewhere. I mean, I guess you can't do that now, but the idea being that, proactively give help, because sometimes people don't feel comfortable asking for it, even though they need it. So
this is where social support really helps, and having a community and knowing your community and finding ways to support one another through this moment and getting creative in doing so, like you said, in a safe way given COVID.
Right. Are there any other resources that you recommend for families, things they can go to or read? Or
so for anybody who's interested in learning more about mental health or the work that our group is doing, you can certainly come on over and visit the Boston University School of Public Health website. And at the end of this show, I believe the editors are going to help us put together some resources that folks can reach out to, so that if you are feeling in distress in this moment, or if listening to anything that we've talked about is upsetting, that there are resources that you can call for free right now to reach out. So there are a number of resources, and I do hope people will consider taking advantage of them. And for anybody who is feeling down in this moment, just know you are not alone, and that care can help.
Thank you. I really appreciate you joining us today and talking about what is sometimes a difficult conversation. And I appreciate your hope. I feel the hope as well that we are a good community and we are there for each other. So with that, we will provide more resources as a link below. And if you need additional resources, the Child Neurology Foundation has a series of content, and you can find it at childneurologyfoundation.org neurologic.org/COVID-19. And together we will get through this, and together we are all child neurology.